When it comes to summer vegetables, we often think of the bright red tomato shining like the sun. It is said that tomatoes are rich in nutrients, and among them, lycopene is particularly noteworthy. Did you know that this lycopene is actually the substance that gives tomatoes their red color? Lycopene is also said to be effective in preventing lifestyle-related diseases and in inhibiting aging. In this video, we will explore the health benefits and side effects of tomatoes, beginning with the effects of lycopene. If you're someone who loves tomatoes and eats them often but wonders if you might be eating too much, or if you vaguely understand that they're good for your health but don't know exactly what effects they have, please keep watching. We might be able to answer your questions. Hello, we are Medivery University Hospital. Our channel provides information about diseases and medical health according to a Japanese physician. If you are interested, please subscribe to our channel. Nutrition of tomatoes. The allure of tomatoes lies in their low-calorie content while being rich in a variety of nutrients, making them a healthy vegetable. Some of the nutrients found in tomatoes include vitamin C, which is beneficial for beautiful skin, vitamin E, which has anti-aging and antioxidant properties, potassium, which promotes the excretion of salt, dietary fiber, which supports gut health. Tomatoes contain a well-balanced variety of nutrients, including these and more. In addition, lycopene and beta-carotene, which are part of the carotenoid family, have been receiving increasing attention in recent years. The main health benefits of lycopene and beta-carotene are their antioxidant properties, similar to those of vitamin E, which are fundamental to anti-aging. It goes without saying that most living organisms on Earth, including humans, cannot survive without oxygen. Oxygen is, in a sense, the source of our life. However, while oxygen breathes life into us, it also oxidizes the cells that make up our body, leading to aging, arteriosclerosis, cancer, and other lifestyle-related diseases. The action of preventing this oxidation of the body is called the antioxidant effect, and the antioxidant effect of tomatoes is receiving a lot of attention. Among the nutrients that demonstrate antioxidant effects, lycopene has been found to be particularly potent, with twice the potency of beta-carotene, 100 times the potency of vitamin E. It has been found that lycopene is exceptionally effective compared to other nutrients with the same antioxidant properties. In simple terms, this means that eating tomatoes can strongly prevent the aging of the body. Effects on diabetes and dyslipidemia. Recent studies have also shown that consuming tomatoes can improve conditions such as type 2 diabetes and dyslipidemia. A research group from Kyoto University in Japan discovered that linoleic acid, a type of fatty acid found in tomatoes, has the potential to improve dyslipidemia. Dyslipidemia is characterized by elevated levels of cholesterol and triglycerides in the body, leading to the development of secondary diseases, such as arteriosclerosis and myocardial infarction. However, linoleic acid in tomatoes has been found to ameliorate these lipid abnormalities. Furthermore, a research team from Tokyo Medical and Dental University conducted an experiment involving 95 women aged between 40 and 60. In this study, the participants were asked to consume 200 milliliters of salt-free tomato juice twice a day, before breakfast and dinner, and their blood was tested for changes after 8 weeks. The results showed that women who consumed tomato juice had an average reduction of 66.9 milligrams per deciliter in triglyceride levels, and an increase of 169 kilocalories in daily energy expenditure. This suggests that regular consumption of tomatoes can reduce triglycerides accumulated in the blood, liver, and muscles, and also increase basal metabolic rate. Researchers from Tokyo Medical and Dental University stated, postmenopausal women are prone to accumulating triglycerides and have a lower basal metabolic rate. Our findings indicate that tomatoes are an effective food for improving these symptoms and metabolic syndrome. Lycopene is heat-resistant. Tomatoes, rich in healthy nutrients, often face the challenge of efficient nutrient intake. While tomatoes can be eaten raw, relying solely on methods such as juices or salads can become tiring. Furthermore, many nutrients are sensitive to heat or easily dissolve in water, making continuous consumption through limited intake methods difficult. In the process of studying specific diets, it was discovered that lycopene, a major nutrient in tomatoes, is resistant to heat and dissolves easily in oil. The diet method in question may already be familiar to some of you, but it has recently become more commonly heard of: the Mediterranean diet. In the Mediterranean diet, a sauce made with tomatoes and olive oil is frequently used, and through research, it has been discovered that lycopene is heat-resistant. The fact that important nutrients are not lost even when heated means that you can intake the nutrients of tomatoes even in frequently eaten dishes like pasta and pizza. The versatility of using tomatoes as a healthy ingredient in various dishes is a significant advantage. Synergistic effects of olive oil and tomatoes. An experiment focusing on the potential synergistic effects of tomatoes and olive oil was conducted. A research team from the Faculty of Medicine at the University of Barcelona in Spain divided 40 participants, both men and women, with an average age of 28 into 3 groups. Each group was instructed to consume raw tomatoes at 7 grams per kilogram of body weight, tomato sauce at 3.5 grams per kilogram of body weight, tomato sauce cooked with olive oil at 3.5 grams per kilogram of body weight. Blood tests were conducted before and 6 hours after the meal to compare cholesterol levels. The results showed that the group who consumed tomatoes cooked with olive oil had the most significant reduction in total cholesterol levels. Specifically, the simultaneous intake of olive oil and tomatoes resulted in an average reduction of 9.03 milligrams per deciliter in total cholesterol, an average reduction of 2.0 milligrams per deciliter in LDL, bad cholesterol, an average increase of 2.36 milligrams per deciliter in HDL, good cholesterol. Olive oil is known to be rich in oleic acid, a monounsaturated fatty acid which is said to have cholesterol-lowering effects. The results suggest that the combination of oleic acid from olive oil and lycopene from tomatoes has a synergistic effect, making it easier to lower cholesterol levels. The Mediterranean diet, which served as the basis for these studies, is a diet method devised based on the eating style of regions along the Mediterranean coast, such as Italy and Greece. It is characterized by a high intake of vegetables and fish, and the abundant use of olive oil. In regions where this diet is traditional, there is evidence of fewer cases of cardiovascular diseases like myocardial infarction. The sufficient intake of tomatoes and olive oil is considered to be one of the contributing factors. Researchers have stated, tomatoes become easier to consume when cooked into a sauce, making it a simple way to include them in your daily diet. This discovery highlights the potential of tomatoes in preventing heart diseases when consumed daily. Side effects of tomatoes. While tomatoes offer numerous benefits, there are also points of caution to consider. Here are some side effects of tomatoes. Hay fever sufferers should be cautious about the intake method. Tomato juice is said to be an effective drink for combating hay fever. This is because lycopene, a component of tomatoes, has the effect of suppressing allergic reactions, which can help alleviate symptoms. However, those who think, "I have severe hay fever. If it's effective, I should eat tomatoes," need to be cautious. For those who have already developed hay fever, eating raw tomatoes is actually not recommended. Processed tomato products such as tomato juice are fine, but the protein structure of raw tomatoes is similar to that of cedar pollen, and this similarity can cause the body to mistake the tomato for pollen, leading to an allergic reaction. People without allergic reactions can safely consume tomatoes, but hay fever sufferers should opt for cooked tomatoes instead. Cooling effect. In traditional Eastern medicine, tomatoes are classified as a food that cools the body. This is beneficial during the hot summer months. But excessive cooling can impair gastrointestinal function and have adverse effects on the body. Overconsumption of cold foods can also temporarily irritate the intestines, leading to diarrhea. Be cautious not to eat too many cold raw tomatoes at once. Digestive issues. Tomato skins are primarily composed of indigestible dietary fiber. Have you ever noticed red particles in your stool the day after eating tomatoes? While moderate consumption is generally fine, overeating can lead to constipation or diarrhea. It's advisable to peel tomatoes or soften their skins through cooking before eating. Peeling methods include blanching or roasting, but for cherry tomatoes, freezing and then dipping in cold water can easily remove the skin. Freezing also preserves nutrients and enhances umami. Risk of gallstones and calculi. Tomatoes contain oxalic acid, which can increase the risk of developing gallstones or urinary tract stones. Although the amount is small compared to foods like spinach and coffee, it's still important to be cautious with consumption. Since oxalic acid is water-soluble, boiling can reduce its content. Also, consuming calcium alongside can decrease absorption. Yellowing of palms and soles. As mentioned earlier, tomatoes contain carotene, a type of carotenoid. It is often said that eating too many oranges can cause the palms and soles of the feet to turn yellow. This is due to a condition called carotenemia, caused by excessive intake of carotene. This can occur not only with oranges but also with other foods high in carotene, so tomatoes are no exception. Those who are concerned should be careful not to overeat. Itching and hives. The substance acetylcholine in tomatoes can cause symptoms like itching and hives. Unlike food allergies, which are an overreaction of the immune system, this is a pseudo-allergen effect where acetylcholine in tomatoes directly causes allergy-like symptoms. These symptoms may not always occur, but if you experience discomfort after eating tomatoes, it's important to be cautious. If you have any concerns, seek medical advice. What is the recommended daily intake? The recommended daily intake of lycopene is 15 to 20 milligrams, which translates to approximately 2 raw tomatoes, or 10 to 15 cherry tomatoes. In terms of tomato juice, this is about 1 glass, and for ketchup, it's around 4 tablespoons. Tomato juice, ketchup, and canned tomatoes are concentrated sources of nutrients, making it relatively easy to reach the recommended intake. What constitutes overeating? There is no specific amount defined for overeating, but based on the upper limit of vitamin A intake, consuming more than 5 to 6 glasses of tomato juice or 3 to 4 raw tomatoes per day could potentially be excessive. Although beta-carotene in tomatoes is a precursor to vitamin A, excess amounts are generally excreted, so strict restrictions are not necessary. Considering the recommended amount of potassium, consuming more than 6 to 7 raw tomatoes per day could be considered overeating. There is no upper limit set for a potassium intake for individuals who are not restricted by a doctor or are not taking excessive potassium supplements, so there should be no issues as long as consumption is not extreme. Physicians' comments. This video has highlighted the abundant nutrients in tomatoes and their newly discovered health benefits. Tomatoes are rich in excellent nutrients, particularly lycopene. It has also been revealed that eating tomatoes with olive oil can enhance their effects. We recommend incorporating tomatoes and olive oil into your meals. We want to know what you would like to see made into a video. If you have any health questions or unexplained symptoms that you're concerned about, please let us know in the comments section. If you found this video informative and interesting, please like and subscribe to encourage us in our future activities. Thank you for watching.